Hospitals in New Jersey are also concerned about supplies and the pace of testing. Cleve Bryan is at Virtua headquarters in Marlton this evening. Cleve?
Well, South Jersey has had relatively few cases thus far of COVID-19, but already hospital systems are identifying the need for more testing that comes back with rapid results and protective equipment for their staff. As the coronavirus continues to spread, those on the front line say they don't have all the tools they need to do their jobs, specifically a rapid turnaround testing system. Virtua Health Chief Clinical Officer Reg Blaber explains.
We have done over 200 tests, but to date, we've really only received results on 5% of those patients.
Blaber says it currently takes 4 to 7 days right now to receive COVID-19 test results. He shared his concerns Tuesday with New Jersey Congressman Donald Norcross, who says he's pressing federal authorities to produce and distribute more testing kits.
We're still nowhere close to where we need to be to make sure that every person that needs a test can get one. We're ramping it up very quickly, but we're not there.
While government officials try to avoid a spike in COVID-19 cases by mandating social distancing practices, a shortage of personal protective equipment could undermine the healthcare system anyway. Slow testing means treating everyone with COVID-19 symptoms as a positive case and wasting precious resources.
Every time someone walks into that room, they have to put on new, fresh PPE. And so that includes a gown, a mask, a face shield, gloves. And as long as we don't know if that person has COVID-19 or not, we have to assume that the patient does. And so it makes us burn through a lot of the PPE.
Now, from the beginning, health officials have said one of the things that all of us can do is if you think that you have COVID-19, call ahead to your doctor's office or to a hospital. They can do a little pre-screening and make sure that they're taking all the precautions necessary. We're live in Marlton. Cleve Bryan, CBS 3 Eyewitness News.
All right, Cleve, thank you.